welcome back to ABA with Dr. D. This is your host, Dr. D. Today we're going to be talking about a new topic. This is for antecedent interventions. Now, before we get into that, I want to appreciate all the support we have been receiving. We are more than 2,000 subscribers. I've said that a million times, but I'm so excited about that. We're now, the next goal is 2,500. So if you haven't done so, please make sure to subscribe to this channel. Also, hit that notification bell because we have a lot of great videos for you. Now, this is once again a really important topic when we talk about high probability, behavior momentum. There's a variety of ways in which people describe this particular intervention. As a clinician, I've utilized this intervention to regain some instructional control or to get my client back on track with certain tasks or activities that were presented prior to an episode or a problem behavior. So it is a very effective intervention. There's a lot of great research available that demonstrates that this particular intervention is very effective. So what we're going to do in this particular video is we're going to talk a little bit about what it is. We do have a video model of that particular procedure that we're going to look at together. So yeah, let's go ahead and start looking at behavioral momentum or high probability. So here it just says a high P sequence is an antecedent-based intervention in which a series of 2 to 5 easy tasks with a known history of learner compliance are presented immediately before requesting the target instruction or the low P instruction. So in other words, you're going to be presenting 2 to 5 instructions that there's a high chance that the client is going to respond to or the person is going to respond to. So it is very essential for you to identify those particular instructions prior to incorporating an intervention such as a high probability or behavioral momentum intervention. This intervention is frequently used to prevent escape maintained behaviors or non-compliance. Now, I have to say that the whole aspect of preventing is very important, but I've also utilized this intervention to reintegrate a client or an individual back on track to a task. So you can either use it once again for prevention purposes or for reintegration purposes. So after a problem behavior occurs, we're trying to assess if the client is ready to get back on track to the original instruction. So here it says that high probability instructions or instructions that the learner will likely follow. So here's some examples. So these instructions vary from individual to individual. So for example, give me a hug, or play with blank. So once again, these are very straightforward. The first one says giving 5. These are very straightforward instructions. These should be easy instructions that individuals should respond to without any complications. Now, if you're going through the sequence and if the individual, for example, has a history of responding really easily to give me 5 instruction, and the client does not respond to that, then that's a sign that the client is probably still upset or is not ready to transition if that's the reintegration portion of it. Now, if you're using it as an antecedent intervention and they're not responding to these instructions, that's where we might want to assess whether they're really, these instructions are high Ps, right? If it's something that is within the aspect of what we will consider instructions that are high probability for the individual to respond to, okay? Low probability instructions are instructions that the learner would not likely follow. Okay, so these instructions are often in acquisition phase. They're actually being taught. There are also things that the person does not really like to respond to very much. Chores or any type of instructions that are being presented to complete something, once again, that they find aversive. And here, like it says, instructions may vary individual to individual. So you may have a matching to sample program, an imitation program, or a tagging objects program. Brushing teeth is another one. I've seen clients that have a hard time transitioning from, for example, watching cartoons or playing video games to brushing teeth. So that's where maybe an instruction, a high probability or behavior momentum intervention could be effective. But once again, that's something that clinician, or in this case, the person supervising the case, the behavior interventionist or behavior analyst that's managing the case, will need to assess if this is a fit or the right intervention for your student or for your child. Okay. Here is a couple more instructions. This is actually an example of a high P instructional sequence. So we start off with the high P instruction of give me high 5, do this, which is clap, touch nose. Okay, so this one, give me a hug, stand up. Okay, so you're able to see that we got 4 high probability instructions in this particular sequence, and the low probability instruction of stand up is at the end. And that's basically the way it looks. It's one of those things that's really fast. You see a response where you're giving them a really quick instructions, and you're getting that response right away. And at the end, we provide that, once again, low P or low probability instruction. Okay. Here it says that, well, this is if you want to do an exercise with with your trainees. If you're doing this for parent training purposes or parent support purposes, you could do this. So you can pair in a group of 2, come up with your high probability sequence. One person can be a therapist, another person can be the child, and we can rotate row after practice. Okay, so that's if you want to once again implement this. It would not be a bad idea if you want to do some type of practice with your fellow colleagues or whoever you're working with there. So here's the video model of this particular intervention. We're gonna look at it together and we can break it up, break it down. So here we go. All right, Janelle, clap your hands. All right, do this. Okay, so I'll stop right there. So I said clap your hands and do this. Okay, those are 2 high probability instructions here. Yeah, touch your head. All right, now you're gonna do number 1. Okay, so I said touch your head, and she, child responded, and then I said, okay, now you're gonna do number 1. So here, the low probability instruction is the homework. Doing some type of assignment. Now, once again, the verbiage that you use is going to be very much based on what your child responds to. Some children are okay with responding to a lot of words. Some children are okay, respond better to very specific, very minimum amount of wording. So you're going to base your instructions, either your low probability or your high probability instructions, based on the history of how well your child responds to instructions with regards to the amount of words you're adding. So in this situation, you're able to see that I'm using a lot of wording. This child has a history responding with this type of sequence. So continue playing. Very good. I love it. Oh my goodness, it looks so great. You're so fast. Yay, Janelle, give me 5. Bam, all right, all done. Perfect. So basically there you're able to see that child is responding to the instructions or completing the task. I'm providing a lot of praise there, and at the end we give a high 5. So once again, reinforcement, we have many videos. If you haven't watched them, you should watch some of these reinforcement videos. We have a variety of different preference assessment videos. We also have explanations of reinforcement that are available for you. We have more coming up, but this particular example here just illustrates, right, provides a very basic example of implementing some high P, some high probability responses, and then after that we implement that low probability, which is doing homework here. We'll watch it one more time so you guys can kind of take another look here. So here we go. And I'll skip the intro here. All right, Janelle, clap your hands. That's one instruction there. Do this. That's 2 high P's, 3 high P's. All right, now you're gonna do number 1. And your low P. Your low P right there. And the response. Very good. And then the consequence, which comes with the praise. I love it. Giving all those wordings. So great. You're so fast. So fast. Yay! Janelle, and a clap and a high 5 at the end. Bam! All right. Awesome. So yeah, this is once again a very basic example of high P's or behavioral momentum. Our video is getting a lot of great views, a lot of traction out there. I just wanted to supplement that video with a bit more instruction, a bit more breakdown of what it is, this particular instruction. Once again, this video will be very helpful if you are learning in school or you're learning, if you are implementing this in the field and you want to get a refresher, this could be a good thing. And also for your trainees, I hope once again this content can continue strengthening your repertoire as a clinician. So thank you so much for watching this video. Much love to you guys. We will see you soon. And I have to say it again, if you have not subscribed, make sure to do so. Hit that notification bell. Take care now.